Hello, 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 everyone. Welcome to another episode of Sree's daily global COVID-19 show. My name is Sree Sreenivasan, and it is my honor to convene this daily conversation around various aspects of COVID-19. Today is episode 227 in 227 days, and our topic, deaf folks and the pandemic. As you can see, we're starting this episode a little differently. We're live on camera as we're starting because we have our friend Malik with us. He is an American Sign Language interpreter, and he is going to help us tell this story about how deaf people are handling the pandemic. We have a very special guest with us as well, Patrick Dehan, who's a reporter and international news curator, and the co-founder of accessiblemasks.org will be joining us in just a moment. This is the first time that we have had this topic covered in 227 shows, and I'm sorry to say that we did not tackle this topic before, but we are honored to be able to tackle it in this fashion at this moment. Please ask questions, please share your comments, please tell us where you're watching from. I know to a lot of us, the chance to talk to someone like Patrick and to have Malik with us is an unusual opportunity. And we want to make sure that we are able to understand the impact of COVID on the community and also to tell the story of the community. So everyone who's watching, we're live right now on Facebook, Twitter, YouTube, and on LinkedIn. And you can share and tag your friends right now so that they can watch us live or watch us later. And if you haven't seen the show before, we are on every single day. And in our first 215 episodes, we've had more than 1 million viewers. We've had more than 386 guests from 68 cities and 20 countries, including the chief scientist of the World Health Organization. Our archives are on youtube.com/Sreenet, and we're in partnership with Scroll Global and Scroll.in. Please check them out. We're very grateful to our sponsors, and we're grateful to our producers, Rose Horowitz at Rose Horowitz 31, and Vandana Menon, Vandana_Menon. Please follow them on Twitter, and they will be live tweeting and sharing aspects of this episode as well. So if you are all ready now, we can get started and bring on Patrick to say hello to all of you. Please hit share so that your friends can join us. Please tag, please retweet so that we can all learn together. Our guest is Patrick Dehan, who is a reporter and international news curator, and he's co-founder of accessiblemasks.org, and he will explain how they work and how he came to create this company. So with that, I am pleased to bring on stage Patrick Dehan. Hi, Patrick.
Hello, everyone.
I'm going to start, Patrick, by asking the same question I ask all our guests. How are you? Where are you? And how's your family been handling the pandemic?
So I'm doing well. Thank you very much for having me on tonight. Right now I'm in Brooklyn, New York, and so I've just been handling the pandemic and trying to find solutions in accessiblemasks.org.
And how has the family been handling the pandemic and your friends? And
oh, we've been doing well. You know, my family, we're very close-knit family, keeping in touch with WhatsApp messages and video calls. My brother is deaf as well, and he's in San Francisco. And we had a WhatsApp call before I jumped on here.
So your days are very much like the rest of us. We're on electronics all the time and doing Zoom calls and things like that. I do want to ask, first of all, I want to apologize if I make a faux pas in any way in terms of addressing some of the questions that might come from me or from the audience. So please bear with me. And if I may ask right at the beginning a insensitive question, can you explain the extent of your situation with deafness and how you are, in fact, communicating with us today? And again, my apologies for being so direct.
Oh, no, of course. So I have a hearing loss. I was born profoundly deaf, and I wear a cochlear implant to help me hear and speak. I went to an oral deaf school and learned how to hear and speak. So it's very difficult to go out in the hearing world. I'm working hard and communicate with others, and trying to speak and understand others and try to understand what we're communicating. So with the face masks, I'm also dependent on lip reading. So the way I describe my communication, and this is not the same for everybody in the deaf and hard of hearing community. Everybody has different levels of hearing losses. So with my hearing loss, I like to say that I am 50% lip reading and 50% hearing with my cochlear implant. So with the face masks, that is removing the communication aid that I have in lip reading and communicating with others and getting facial cues, facial expressions. So with the face masks under the pandemic, it was a brand new language barrier and communication barrier for myself and the deaf and hard of hearing community who hear and speak with their hearing aids or with their cochlear implants. And for the deaf and hard of hearing community members, hard of hearing members in the community, they may use sign language and not use hearing aids or cochlear implant, and they sign. They still need the lip reading or the facial expressions and facial cues, and with the face masks that has taken that away. I hope that answers your question.
It does, and we want to make it clear that there are so many different ways in which people experience deafness, and therefore yours is only one experience and one level. You're not here to speak for the entire community. And even in our topic, we made, by calling it deaf people and COVID, we kind of overstate what we're trying to do here. We're trying to understand your story and also trying to understand what are deaf people going through in the pandemic and what are the unique challenges that they have. If you one thing that we could maybe talk about, since everyone who's watching, we're seeing Malik with us. He was kind enough to be with you here today. Would you like to say anything about what he's doing? And as ASL interpretation, that obviously to an ignorant person like me makes me think, oh, there must be therefore other kinds of sign language. And did you learn it growing up? And so if you can talk about Malik a little bit, what he's doing, and about that as well. And may I ask, is it harder to read my lips in the smaller box? Do you want me to be kind of bigger when I ask questions, or is this okay?
Oh, I can understand you clearly. Thank you so much for making sure. So with Malik here, he is translating what we are saying verbally and translating it into ASL. And I'm very grateful to have Malik on today to translate for any deaf community members that may need ASL translation. And I am also happy that Sree also does captioning on their shows here and on YouTube. So after the show, the YouTube broadcast will have the captions on. And so that way the show will be accessible for all. I do not know sign language very well right now. I knew sign language when I was very young. So I was diagnosed profoundly deaf at 9 months, and I got hearing aids at 10 months. My parents taught me sign language very early on, and I learned, I was very fluent. This was before I went to oral deaf school. So I really transitioned to focus on that. I still have many deaf and hard of hearing, deaf friends in the deaf community that sign, and I pick it up and I'm reminded of certain signs here and there. So, I'm still somewhat familiar, yes. And I'm very grateful to have Malik here.
Thank you very much. Can you talk about different kinds of sign language for a minute? If there is an American Sign Language, that means there are others as well.
Yes. I am not too experienced in the sign language community, but I do know there is British Sign Language, and there is different regional languages, and there's also slang here and there with sign language. So, it's regional, and you may want to learn sign language here and there. Yes.
And what were some of the circumstances that the pandemic has brought to make it more difficult for deaf folks to go about their work, their lives? What has happened?
So, like as I explained earlier, that the pandemic with the face masks, it's brought a brand new communication barrier to the world and for deaf and hard of hearing people across the world. 5% of the world, according to the World Health Organization, has a hearing loss or a level of deafness. So for deaf and hard of hearing people going about their day in the pandemic with face masks, it's very difficult because, we understand that face masks are important in trying to prevent the spread of coronavirus, but it's a huge barrier that we have to contend with. So with this, we cannot go out into the world and communicate with people and asking questions on public transit. Going to vote in an election, for example, I did that in the New York primary earlier in the summer. It was very difficult trying to understand what the poll workers were telling me in terms of what to fill out in the ballot. Going to the post office, I had questions to ask at the office about mail, or they were asking me questions and I had to ask them to repeat. So the everyday things going out in the world and doing things, traveling. So we are going out and about and being faced with people with, face masks, and you're left alone trying to understand what people are saying to you. And if you have questions to ask in terms of essential workers or service workers, you want to ask them questions. Sometimes you might want to take it as a deaf person. I'm like, it's an extra thing and it's harder. So you almost want to take a step back. You're like, I don't really want to ask this question. I don't really want to do this. But in certain situations like voting or going to the hospital, I know I have to ask the question and I'm going to deal with it and face with it. It's just more difficult. Yeah.
So let's just explain to everybody how this works. So by the way, I got these excellent masks that I saw someone wearing. They're called BAGGU. And I love them because they have this unusual the thing that you can do with them.
Oh, the filter, yeah.
So they have a little extra here. Do you see that? So you feel extra secure that the germs are not the virus is not getting in. Anyway, now if you're lip reading, then you can't see this, right? And so not everyone has implants, and so there are three ways I gather that people can understand. So one is through lip reading, one is through the implants, and one is sign language, right? And one is through, so sign language is the third.
Yes, so like with your, I'm sorry, I didn't mean to interrupt. So like when you're wearing the face mask, I can't lip read you. People can't lip read you. We can't see any facial expressions or facial cues, like we might grin or laugh, we might chuckle or we might do a little smirk or something like that. We don't get that extra help in communications going out and about. So it's very difficult, and we're depending on using our hearing aids or implants, or you don't have them at all and you can't understand them at all. So it's very difficult, yes.
So you have a solution for that. It's called accessiblemasks.org.
Yes, so this is an example for what can be a solution. So there are clear masks with transparent windows, like this one is a see-through window. And it's just like any other face mask with the little straps here. This is, and you just put it on just like this, and you can see my mouth, and you can lip read, or you can communicate with others just like this, and you can laugh or smile and like be able to get the facial cues and expression that help with communication. So accessiblemasks.org is a resource that my brother and I created to have multiple vendors. And this is just from one vendor that we host on the site. And there are many different designs. There are facial coverings that cover the whole face, and they're all transparent. You can see the entire face. Or you could get the standard face mask where you can get straps all around or around the ear. There are so many different designs out there. And so we created this resource to make it easy for everybody to learn about why these transparent face coverings are important and who they help. And we also want to make it easy for people to find them instead of, trying to find stuff on Google or Facebook, So we want to make it all a central resource where it's educational and simple for people to use in order to get a transparent face mask.
Well, congratulations on this and for making this possible for folks. I realize when I turn off my camera, I make it, you can't obviously lip read, so you're hearing through your through this. So have people started buying these? And is it deaf people who should buy them, or should everybody buy them? And what do you recommend?
So that's a very, very good question, because we need everybody to wear them for them to really work, because I shouldn't be wearing the mask. Other people that I communicate with should be wearing the accessible mask so that I can understand them. So hearing people should be wearing them. Anybody who is communicating with a deaf or hard of hearing friend or a family member should be wearing them. So like, for example, I always carry one or two in my backpack. But whenever I'm going to meet a friend or a family friend for a coffee or go to get lunch, and then they can wear it, so I can communicate with them, yes. So it's just the hearing people that we're communicating with, yes.
This is so important. I know people have questions, so please jump in and ask questions as well. We'll read some of the comments right now. These are comments that have come in from people around the world. So we're just going to put them on camera right now. So let's see here who is watching. Jacob is watching. Tell us who Jacob is.
Oh, geez. This is my brother, Jacob. He's chiming in from San Francisco.
Very nice. Nice to meet you, Jacob. Thank you for
I'm sorry, I didn't mean to interrupt, but so he started the website with me and did the design work, and I'm more of a writer, so we kind of did a marriage there on the website. And he did a lot of curation and finding the vendors that we host on the site. Yes.
And you both work together so well. on this project. One of the things that we're always talking to people about is collaboration during the pandemic, innovation during the pandemic, and you were able to work together on this. Let's keep going. Jonathan's watching from the East Village. He's ready for the Day of the Dead, as you can see, and he has watched 227 episodes in a row.
Oh, wow.
With us, so thank you. And he says, watching and listening thanks to hearing aids. So Jonathan, I mean, this is one of the things that we should all note, that it isn't just people who are born deaf or have deafness through an accident or something, that there is a natural process where hearing loss happens to people. I have one of my dearest friends at 40 years old was wearing hearing aids. So it isn't, you don't know which age group people are going to get either, right?
And it's also a very important point that we need to make, that the pandemic is hitting older and affecting older people. And so with older people going to the hospitals and getting care for COVID, it could be hard for them to hear in the hospitals. And they're going to meet nurses and doctors with face masks in the hospitals. So it's very difficult, a very difficult situation with deaf people and hard of hearing people in the hospitals. And I think that's an important point as well. So there are solutions in going to the hospitals when you're deaf, and seeing face masks by every healthcare worker there. Like sometimes use speech to text apps like Otter.ai or Ava. Those are two apps that you can use on your phone, and the doctor or nurse with the face mask can speak, and they can translate it into text. So that's a way to communicate in a hospital or anywhere when you're speaking with someone with a solid mask. There's people taking notes or using whiteboards. So, there are solutions, yes.
I should say that about an hour ago, I had a COVID test, negative, thank God. And how much of those interactions were with people fully wearing masks, including the nurse who very kindly stuck that swab right up. By the way, no one tells you how far up they go. I don't know if you've had a COVID test yet, Patrick, but it really, they go deep into your nostril. And I can imagine if I was deaf and I needed to be able to lip read, how difficult that would have been. I mean, it's something that you don't understand when you don't deal with the situation.
Exactly. I mean, I've been to get tested, I believe, 2 or 3 times so far. And it's very hard because they're in these tents that are very loud and noisy with the ventilation. And it's very hard to hear. I mean, it would be so much easier to try to understand them if it was a quiet space and, I was closer to them, but we had to keep a distance. So there's all these extra barriers, with the noise, the ventilation, and the space, and the face masks. It all adds up, the challenges. So I just feel that a lot of nurses and doctors know how to have patience, and they will repeat for me. So I just ask them to repeat so that I can answer their questions correctly. Another solution is, as a deaf person, it's good to know what I'm going to be asked and potentially how it's going to be asked, or like in what order they're going to ask me the questions, because I've been to get tested for the second or third time, and I know what they're going to ask me. So I can kind of get it and be like, okay, you're asking for my name. Have I been here before? Yes. And so on, so on. But, that's not easy everywhere. Like when I went to vote for the primary, I didn't know what they were going to ask me. So, so there's these solutions and challenges, yes.
Folks, everyone who's watching, please share this right now with friends and family around the world. They can watch it live or later. Please retweet, please share. I know that Jake has done this and Patrick has done this as well, but please hit share so that they can do it. The only person who hasn't had a moment is Malik because he's working so hard right now. So he will share it afterwards for his family and friends to watch him as well. I'm just going to read some more questions, and Jake is also going to answer questions in the chat. He said, my mom is watching from Kerala in India. Hi, Amma. Love you. And have you been to Asia or to India, Patrick?
Mm-hmm. Yes.
Where have you been?
I'm sorry. Could you ask that?
Have you been to India or to Asia?
Indiana.
India, the country of India. Have you been to India or to Asia?
Yes. So I went to Nepal a couple of years ago. So I did a little stopover in New Delhi and then over to Nepal and Kathmandu. I went in 2015 and went to Nepal, Kathmandu to help with humanitarian issues there and educational schools there with a Buddhist group that I became friends with. And we went up to the mountains to a remote village that was impacted by the earthquake back then.
That's right. There was a major earthquake in Nepal. So thank you for going there and helping my part of the world. Fernando is watching from Los Angeles. And Mary and Charles are watching from New Jersey. And Charlie is not just a regular viewer. He is also a sponsor of the show. And that is his book right here. It's called The Inventor in You. And it's a step-by-step guide to your first invention. And I know he'd be very impressed by the innovation with these masks and how people are working in this moment. Let's see, other people are coming on, and Fernando says, wonderful show topic, thank you. And Cherry says, good morning. Fernando says, can apps like Google Translate because of assistance in large print, because they're able to make text bigger? Can you talk about that a little bit, please?
So I believe Google Translate and it can have big text that would help in terms of speech to text. In situations with face masks or speaking with anybody out and about. There is Google, I think it's Google Translate. There's another Google app. I can't, it's not coming to me. That also translates speech to text. And I use it all the time, yes. And they do have big text, large print, yes. You just said it in the settings, yes.
And Jake is in all the platforms. There he is in LinkedIn, and here he is in Facebook, and he's posting there. So that's great. And Fernando says, interesting, but are there problems for other languages as well? English. So what happens to Spanish speakers? What happens to other languages? This must be also difficult.
Yes, so not just for deaf people, but also for people with foreign languages who may not know English, or they might be learning English, or they might be learning Spanish, or anywhere they are in the world. They may need the facial cues and facial expressions or lip reading if they learn how to lip read the other language. And they're still learning it. And the face mask is a communication barrier in that. That is so true. It's older people who might have degrading hearing and foreign language speakers and learners. Yes, absolutely.
Thank you. We are going to keep looking at comments. And Cameron's one of my students and watching from Ronkonkoma on Long Island. And Martha says, Mom is watching from Massachusetts. Our family went on vacation together, and we all wore accessible masks so Patrick and Jacob could understand us. So this is Mama Dehan?
Yes, this is my mother. So my parents are both hearing, and they, raised both of us, two deaf kids. So they understand what we face, and they support us. So they all wore these masks, and we run it safely to a local vacation, and we wore the masks when we walked around the town, to the beach, and around the hotel. So, I could understand them. And Laprida, my brother and I, so we could understand them.
And there may be reasons, even if you have an implant, to lip read because the batteries may be having trouble, or it's too noisy, as you said, or you're too far away, as you said. So those are other reasons as well. So you cannot rely on just the technology. Is that correct?
Yeah. Yes, because the technology is not a cure, or people want to believe it's a cure. It's not a solution to our hearing loss or deafness. For hearing aids or cochlear implants, they do not solve what we face all the time. So, like, I like to say it helps, lip reading helps, and hearing. I like to explain it as there's a difference between hearing and understanding. So I may hear you, but I may not understand you. So that's what it is in terms of my hearing loss and deafness going out and about.
Thank you so much. I'm learning a lot. I'm very grateful. I want your mom to know that my mom is watching. So we connect the two mothers right here. Caroline in India and your mom in Massachusetts are now connected. And we're very grateful to your mom for joining us as well. And Charles is here and says, very meaningful and appropriate topic during this difficult time, especially for the hearing impaired. Thank you, Sree, for presenting this important guest. Thank you so much, Charlie, for being here. And thank you to Malik. Let's give him another shout out. He is, you and I are having a nice conversation. He's working.
I know.
And Jonathan says his hearing loss goes all the way back to 8 or 9 years old. And Fernando's thanking Jacob. And Jake says, glad it was a negative test. And we have more comments coming in. And Mom and Dad are very proud of Patrick and Jake. They put this website together, despite one of them located in the West Coast, other on the East Coast. Everyone needs to wear an accessible mask. So I just bought this mask, but I will get an accessible mask. And I'll also, maybe the brands that we like should be encouraged to make accessible masks as well, right? You're not selling these, you're a resource for masks. You're not inventing masks. This is one thing we can all do, is if we have a mask company we like, we can encourage them to make an accessible mask. And then Love Fractal tweets ASL forever.
Exactly.
And Jake says, I'm whizzing around doing my best to help out since I couldn't hop in. So he's working in different places.
Yes.
And Linda said, I almost typed, I'm watching from New York City, actually watching from the New York State Berkshires, closer to Massachusetts.
Yes, it's very close. The Berkshires are beautiful.
And we, of course, Jacob is giving a shout out to Mom. And Jonathan saying, hearing aids work wonders, not miracles. Beautifully said. Thank you, Jonathan. And Martha says, I'm doing a great job. I'm very touched. For those of you who joined late, I started by apologizing for any faux pas, any mistakes that I might make. We're trying to be, I am ignorant. I'm sorry to say that I'm ignorant about issues with deaf folks, just because I think those of us who can hear take it for granted, and we should not.
Thank you so much. It's been great being here, and it's been really accessible, and I really appreciate the way you handled this, and definitely. And I'm nervous, so I'm, trying my best here on this call. So, yes.
Thank you. Jonathan says, also tech can fail, which means the hearing disabled is without the aids while they're in the shop. So are hearing aids expensive? So we shouldn't think of it the way I might think of a pair of headphones or AirPods, because these are expensive, high. I mean, of course, AirPods will also tell you that they're very high tech, but these are tools of life and work, right? Not just play the way they are for me.
Yeah, they are expensive. It's an added healthcare expense that we have to take on, and so there's batteries as well. So we don't hear when we are in a shower or when we're sleeping, and sometimes when we're out and about, our battery may die, so we will have to change it out. And that actually happened to me when I was in the COVID tent trying to get tested and answer questions with the nurse. And my implant battery died. And I was like, I'm really sorry, but I have a hearing loss. Can you please wait 1 second? I need to change my battery. And they're like, they were confused. They didn't know, but I explained it to them, changed it out, put it back on. I'm like, okay, I can hear now. And then we went on and answered questions. Yes.
I am learning so much about this. So it isn't. So the battery. I was saying it kind of theoretically that the batteries could die, but it happened to you while getting a COVID test. That is an incredible story.
I know, so stressful already, and then you add that on. It's like, yeah.
I can, for those who missed it, I just had a COVID test an hour ago, and I'm telling my mom it was negative, but it was stressful. So in top of that, to have my nurse not understand what I'm saying, it would have been really difficult for me. Jake says, and again, for those of you who are joining late, Jake is the brother of Patrick, and they're both hearing impaired. That's the right term, I guess, and you use with different degrees, right? So some people are fully deaf, and then some are hearing impaired. And Jake says, yes, the difference between hearing and understanding is very true. Cochlear implants are and hearing aids are not a cure. They're assistive devices and tools. Thank you so much. And Malik is working very hard, says Martha. I want to see if Malik was going to sign his own name, what it would look like. So that's what I was looking for. And Charles says, what a clever idea for this new mask. Very ingenious idea indeed. Any patent issued on this? I know we saw in the early days of the pandemic, we saw some people had made versions of these masks. Can you talk about that? By the way, Charlie has 85 patents, so he knows, and most of them dealing with plastics and those materials.
So in terms of the patent question, I don't think there is a certain patent, but for the medical grade see-through masks, there are two masks companies, vendors that we highlighted, the Clear Mask and the, I can't remember what the other one is right off my head. There are two mask companies that are FDA approved and are medical grade, and they can be used in medical settings. So those are patent approved and FDA approved, but anybody can make them. So there are some Etsy vendors that we feature that are very good quality, and people have ordered from them. So there are many people making them at home with plastic they can get online and stitching it very, we want to protect from coronavirus and prevent the spread. So we need to make sure that it's tightly woven and stitched so that nothing gets through in the edges. So that's what the CDC says in terms of these masks. A very interesting fact about the CDC is that they did not initially support these masks. So a deaf and hard of hearing organization petitioned them and wrote a letter to the CDC saying you should recognize these masks so that we can support the deaf and hard of hearing community during the pandemic. And then the CDC amended their guidance to say that you can wear these masks to when you're interacting with the deaf and hard of hearing people, So they just advise that you get good quality ones and that is tightly woven and safe.
So that means that they weren't ready for this. They were not thinking about this issue, and that's why they ended up with this problem, correct?
Yes. They amended their guidance to include us, yes.
That is, I'm glad that they did. And this is why activists exist. This is why people speak up. Advocates exist as well. And can I ask you another awkward question? What effect do accents have on lip reading and understanding? So if I'm not a native English speaker, you're an English speaker. if I had a non-American accent or a non-fluent accent, how does that affect your hearing?
So in terms of the accent, it is difficult to understand you. Of course, I'm not used to different accents or different speeds in speaking. So there's a bunch of different different ways people speak that can present a challenge, but it's different for everybody with their level of hearing and deafness, of course, and how they can understand different accents or different ways of speaking. Yes.
Got it. Folks, we only have
I'm sorry.
I was going to say, folks, we have only a few more minutes left with our friend Patrick and Malik, who is signing for us in American Sign Language. And we would love to ask, if you have any questions, there's a chance to ask Jacob, who is Patrick's brother, who is watching as well. And Jacob's mom is watching, and Patrick's mom, she's watching as well. And let's see. Martha says, thank you, Sree, for making this clear that they are a resource. Linda says, this is such an important topic. People should encourage mask makers to make accessible masks. Thank you for saying that. Martha says, no apologies needed, Sree. Thank you very much. Jonathan says, hearing aids are very expensive. And by the way, my grandsons are learning ASL in their daycare. The 5-year-old teaches me to sign the letters of his name. So I guess that is really amazing. And Jake says, this is a totally valid statement. The majority of our vendors on accessible masks solely sell clear face coverings. However, it'd be amazing if other vendors could add clear masks to their product line. So I'm going to reach out to this company, which I like, called Bagoo, and tell them to add. I'll send them a link to this video, and I'll tell them to add this. Martha says hearing aids and cochlear implants are expensive and not always covered with health insurance. Why would they not be covered by health insurance?
Well, that's a tricky question. They don't. I can't answer that, to be honest with you. It's a big expense for health insurance to take on, so they will only cover a certain amount of the cost. And so we have to petition our health insurance to say that why we need it. And, so that's really the kind of situation we're in with health insurance.
Got it. And we are still looking at the questions. Jake says, I'm not sure if there have been patents, but there are FDA-approved masks that we've featured so that they're medical grade ones available. Jonathan says, I have to recharge my hearing aids every night.
Yeah.
And Martha is asking a question of Malik. What is his name sign? So I should tell you that Malik told me off camera before that he doesn't answer questions. If Patrick says something or answers a question, he will then sign it, but he doesn't participate except to interpret for you. So that is the signer's code, I guess, and the way of working. Martha says, one accessible mask I wear, Jake actually made. Of course, we like the one he made. And these are the brands. The Clear Mask and Safe and Clear are FDA approved. And James says, go Patrick. And Jonathan says, hearing tests are free, however, and there are different levels of hearing aids. Roughly speaking, the better the aids, the more expensive.
Yes. Very true, very true.
All right, so one thing I'd like to do is maybe just take a break for a minute so that we give Malik a moment to just relax, and we'll put back on the screen the overlay so that people know what we're doing. We'll wrap up with some final questions and some final thoughts from you, but I want to give Malik a moment to just relax. Okay, everybody, hello, and thank you for being here. I didn't warn Patrick, and so when he was drinking water, because I didn't want to say anything that couldn't be interpreted at the same time. That's why I did not speak under the overlay. This has taught me so much today about how we need to be much more aware of all our audience members. I think accessibility with computers has been an issue raised by blind people very early. I wrote an article in the New York Times in 1996 about blind people using the internet. And because their disability is different from yours and different from deaf people, I think it may seem to me even that could it be that there is more activism in the blind community? Is that possible, or am I imagining that and again being ignorant?
Are you asking if there's more activism in certain communities? Is that what you're asking?
Yeah, because deaf people can read on the internet, we don't see the level of activism perhaps that we see with blind people and accessibility with text and things like that.
Yeah, of course. So I mean, I can't compare communities and activism, but definitely with the internet and social media and the way we can communicate now with social networks, there is greater activism and advocacy work and collaboration in supporting each other. For example, when the pandemic started, everybody in the deaf and hard of hearing Facebook groups that I'm a member of was sharing solutions to video calls for work and like live transcription solutions. And these masks, these were all shared in the Facebook groups to support each other. So, there's a lot of collaboration and support and advocacy work because of the internet. Yes, I agree.
Thank you. Martha says, Sree, you're right on the money with the blind. And Jonathan says, weirdly, it is often more difficult to be deaf than to be blind. Again, we're not comparing, but as somebody who has some amount of hearing loss from the age of 8 and 9, the way he did, and he's a journalist, so he has observed, and so that is his observation. Jake, your brother, says, a friend, Stefan Pagano, has a question. I have a cochlear implant, and it is often extremely difficult if there is someone else I'm talking to, whether I'm in a group or at the store, and I can't see their lips to understand them. What is the right etiquette in that scenario? Do I ask them to remove their mask? Wow, just to pause here to say that's an incredibly important question. And again, think of all of the rest of I'm talking to my friends and viewers who don't have a hearing impairment, that we take our privilege for granted. And this is an everyday situation that Stephanie goes through and others go through as well. So over to you.
Of course, I mean, it's a very tricky situation. We want to lip read so that we can understand who we're communicating with, but we also understand the situation we're in with the coronavirus pandemic, where the masks, we understand, it helps stop the spread. So, I mean, it depends on the situation you're in. I feel like if you're outdoors and you're in a certain distance, you could take the masks and lip read them. It depends on who you're speaking with and your comfort level, of course, your level of risk, of course. So it depends on who you're speaking with and your own comfort. But if you're indoors and, we can't be taking the mask off, it's riskier. So I just try to communicate with them that I have a hearing loss, and you might have to repeat, or I'll ask them. Some people ask to type what they're saying on a note app or something like that, solutions like that. So, it depends on the situation you're in and who you're communicating with. Yes.
Thank you. Let's go with a couple of more comments. And Rose has been tweeting. It says, thank you, Patrick, for joining us. Rose is one of our producers and she's tweeting live. So everyone check out her tweets at Rose Horowitz 31, at Rose Horowitz 31. Please follow her. And Martha, your mom, is thanking Stephanie. So that is
a good friend of mine. So thank you.
But before we go, I want to ask a little bit about the importance of the ASL interpreter. Obviously, we'll pretend Malik is not here, so we won't embarrass him by saying what a great job he's doing and how helpful that is. I feel like there's been more awareness of of interpreters like this in real time. It seems to be mandated by the government in some U.S. situations. Especially, we see this during hurricane warning briefings and things like that. That's where I was first aware of them. Do you know, is this under ADA that has to be there? Are there certain circumstances where there should be an ASL interpreter? And how does that all work? If you, whatever you know of it, I know this is not your expertise.
No. I don't know specifically the ADA and law for sign language interpreters, but I will say that I do agree that it is far more prevalent to have ASL interpreters on screen for local and state government broadcasts or speeches or addresses, and for state and local situations in the United States. I'm not sure about elsewhere. I do feel when I watch global news broadcasts, they have sign language interpreters in the corner more so than in the United States in the federal level. Yes.
I see it on the government level, right? State level, state and local interpreters I see as well. Here is a question from Miriam Berkeley, who's a wonderful photographer, says, interpreting is exhausting. I had a class last year with a deaf student at Hunter. There were 2 interpreters who alternated during the 2-hour class. So again, thank you to Malik for doing this now for 55 minutes. We're very grateful to him. Chris R asks, are there any apps or tools to assist deaf if the other person, for example, the cashier, does not have a clear mask?
Yes, like I mentioned earlier, there are services like Google has a Translate app and another app. It's not coming to me the name of it, but Google has a speech to text app. There is Otter.ai, which is also great. You can use it on your desktop or on your phone. There's also Ava, AVA, which is also mobile or desktop. So that helps in terms of using your phone, and they can speak a speech to text, and it's like live captions right there on your phone, so you can understand what they're saying. It might be muffled with the face mask or with the distance, but it helps. It helps.
I'm a big fan of Google Translate's live translation, and now Apple also has some of that, but the Google Translate is much better. I just returned from Puerto Rico, where we were wearing the masks all the time, and I noticed that some of the words were getting muffled, and Google Translate, which normally gets about 95, 98% of my, at least the understanding the English part, was the percentage was falling because of the mask wearing. And that's certainly one of the things that we have seen. But Google Translate is an app that I certainly recommend to folks. And I guess you could do English to English. You could just pick English on both sides, and then it will read out the words on the other side.
Yes.
That's one way to do that, I guess, is what you're looking at. So that's one way to do what they asked about. And Jake says, interpreters are crucial for the deaf community, but not always included. Sadly, like our political debates weren't ASL interpreted. It's difficult to enforce. So imagine the amount of money spent on those debates. The debates commission should include it. That should be automatic on the side and have that certainly for the audience and that. So it's a very important point. And Jonathan says, I've been learning Otter.ai. I'm a big fan of it and recommend it. And could links to the other apps be posted? So we're going to put Jake to work Jake, if you wouldn't mind just putting in some of those, that'll be great. And Jake says, I use Otter AI for work video calls. It is essential for my calls now, and it's life-changing. It does transcripts afterwards. It is sometimes easier to read a transcript than listen to a long, an hour-long audio. You can read the transcript a lot faster. Yeah. And Jake says, I will do this, and we will update our website with links as well, otterai.ai and ava.me, paired with Google ones too. So that is just awesome. So before we let you go, do you have any final thoughts you would like to share with us? I will share once again the website of that you have built. And again, for anyone who missed it, accessiblemasks.org is a nonprofit website that they have built to be a resource for a clearinghouse for information about accessible masks, clear face masks, or where just the lips are visible. I think this is really, really an important guide and resource they've put together for the planet, and everyone should check that out. And please tell your favorite mask maker to make clear masks and to be included in accessiblemasks.org. And Jonathan says, thank you. And Martha is being very polite and very nice right now. Thank you, Martha. Your mom is awesome. Let's go to you with some final words for us.
Thank you so much for having me, and I really enjoyed this conversation. So I just want everybody to be mindful of who you might be speaking with going out and about. Be patient and understanding. You might be speaking to someone who's deaf and you don't know. You might be speaking with someone who has a hearing loss and you don't know. So please be mindful when you go out and about during the pandemic. And check out accessiblemasks.org and maybe pick up a face mask and go into the FAQ page and get all your questions answered about the issues we face. And I'm online on Twitter and Instagram. I'm happy to chat and answer any other questions. So please check out accessiblemasks.org and make the masks world accessible.
Fantastic. Thank you so much. I am so grateful to both of you, to Malik and to Patrick and to Jacob and to Martha. I feel like I got to know the whole family. I was very, very honored that you would spend part of your Friday with us. This will be recorded, and as soon as we're off the air, it'll be available on Facebook, Twitter, YouTube, and LinkedIn, and everyone can watch. Please tag a friend or two, because this is such an important conversation, and I'm very honored that you would do this with us. So I'm going to let you both go. I have some administrative stuff to say. And look at this, Sujana Chandrasekhar, who is the fabulous host of a show called She's on Call, which airs every Sunday on Facebook and Twitter. She and another surgeon, Marina Kurian, are the hosts of that show. And they will be here at 11 a.m. on Sunday. This is the card of last week's show, but Sundays at 11 a.m. Eastern, Sujana Chandrasekhar and Marina Kurian talk about COVID and so much more. So please join us for that. And she says, I have clear masks that I use when I'm talking to my patients who are deaf or have hearing loss. So isn't that amazing? And she's an ENT doctor, so she's obviously very attuned to that. So that is just great. So many other comments coming in. Adrian says, very engaging and informative. Thank you. And Martha says, thank you, Malik. And
thank you, Malik.
And Sujana says, this is really important. Thank you. And Jake says, yes, thank you for talking about something that is so important. Thanks to all who watched. Love accessiblemasks.org and at accessiblemasks at IG and Facebook. And Sujana has just tagged some folks she knows. And Jake says, oh my God, I'll watch the show you're on. Thank you for being accessible. And just you're hearing this, folks. I mean, we talk on the show about being more aware of all kinds of privilege. And certainly I feel like I have been made aware now of my hearing privilege. And Jonathan says, important show. Thank you. And just great to have all these other comments and questions coming in. And folks, we're here every single day. Our topic tomorrow is at 9 a.m. Eastern. So I hope some of you will join us. We are going to do News You Missed. This is our episode about, there's so much going on, as you know, and we are going to talk about that. Oh, and I just realized I made a mistake by putting the overlay card up, and we couldn't see Malik's posts anymore. So this is, again, how easy, here I am being hyper aware, and I made the same mistake without thinking about it. Yeah, and it is an adjustment, and it is something that we all need to be thinking about as we go through our day. So with that, I will let both of you go. Thank you very, very much. I am so grateful to both of you. Good night and good luck with everything. And please keep us posted. Please come back. And Jonathan says, don't miss News You Missed. So on these channels, 9 a.m. tomorrow is News You Missed. And then on Sunday at 11 is the other show on She's on Call. So find that on Facebook and Twitter. Sundays, I'm not showing the other cards, but on weekends we do 5 shows, Patrick. We do a COVID show at 9 a.m. on Saturday, and then from noon to 2 on WBAI 99.5 FM, we do multiple shows around all things to do with COVID-19 and helping people with that. And then on Sunday, we do the New York Times read along, where we read the New York Times out loud like crazy people. We've been doing it for 5 years. And we have Obit's editor of the New York Times will be with us, Amy Padnani, who did the 30th anniversary ADA report in the New York Times. There was a very big report recently about the 30th anniversary. She edited that. And then we have the COVID show again at 9 p.m. So we are so grateful to our audiences of all these shows, and grateful to Malik. Everyone, please applaud Malik, and to Patrick. Goodbye to both of you. Thank you
so much.
Thank you. And thank you to both Patrick and Malik. You were awesome, and I'm so grateful to both of you. Before we go, one of the things we've not had a chance to do in a few days, because we've been doing so many shows, is to talk for a minute about where we are in this country. You may have seen the news just before we went on the air that America had 79,000 new cases today, on a day that the president said that we are rounding the corner beautifully. We had the highest number of cases we've ever had in one day. How tragic is that? And we saw another report today that if 100% of Americans, or even 95% of Americans, wore masks, we would save 100,000 lives by February. 100,000 lives for 95% of us wearing masks. Right now, the number is 45%. It is so tragic that this country, which has 4% of the world's population, has 20% of the world's deaths to coronavirus. This is a failure of this country, led by the president and by governors in many states who failed their people. And folks, you must vote in order to make a difference. And elections matter, not just at the presidential level, but up and down the ballot. Please vote. Everybody, please do that. And we want to remind you that we asked Kimberly Crenshaw, the great Columbia Law School professor who coined the term intersectionality, what can we do to be allies of the Black community? Today, we were trying to be allies of the deaf community. And she said simply, say their names. So I'm going to do that right now. We use this Titus Keffer painting, cover photo painting by Titus of a mother with her child snatched away. The painting on the left, you see the names of victims of police violence all along the border. And on the right, you see young Larcinia Floyd and her son, George Floyd. She would die 2 years, almost to the day that he would be killed on camera. And these are the names: Trayvon Martin, Yvette Smith, Eric Garner, Michael Brown, Laquan McDonald, Tanisha Anderson, Akai Gurley, Tamir Rice, Jerame Reed, Natasha McKenna, Eric Harris, Walter Scott, Freddie Gray, William Chapman, Sandra Bland, Darius Stewart, Samuel Dubose, Janet Wilson, Kaylin Rockmore, Alton Sterling, Philando Castile, Joseph Mann, Terence Crutcher, Chad Robertson, Jordan Edwards, Aaron Bailey, Stefan Clark, Danny Ray Thomas, Antoine Rose, Botham Jean, Tatiana Jefferson, Michael Dean, Ahmad Arbery, Brianna Taylor, and George Floyd. Those are not all the names. Those are not even all the names since George Floyd was killed, but there's some of the names, and we say them here as often as we can. Thank you for joining me in saying those names. Some of those names are household names, sadly, tragically, and some of them are not household names, names you've never heard of, sadly and tragically as well. That's our episode for tonight. I'm so grateful to Malik and to Patrick DeHahn for being here and for sharing the story of the deaf community. And again, just like when we say with the Black community, there isn't one Black community, there isn't one deaf community, and we all need to be much more aware of the parts of the society that we don't know and we don't understand. And that's our tiny attempt here on this show. Thank you very much, everybody, for being here. Please tell a friend about the show. And you can, as always, you can go onto YouTube and hit subscribe on SreeNet. You can see the youtube.com/SreeNet is my YouTube handle. So please go to the channel and please hit subscribe. And also, if you haven't already, this is a WhatsApp QR code. So if you have a WhatsApp, you can just hold up the phone and you will get a gentle alert every time I'm live. This is not a WhatsApp group. It's just a WhatsApp alert when I am live, so you can ask for that as well. And with that, we're going to say goodbye to everybody, and thank you, and see you soon. Bye-bye.